Here, I want to talk to you about assessment number 1 for 7101 NRS. This assessment is due on the 26th of November 2018 at 5 p.m. It is weighted at 30% and you're aiming for 1,500 words. So let's talk through the criteria. So this aim is to enable students to demonstrate their understanding of the impact of leadership on patient safety and quality care delivery in a healthcare work unit. So we ask students to assess a scenario that's relevant to your workplace and identify the potential symptoms of a compromised organisational governance structure or disengaged leadership practices. This assessment will help you develop your critical evaluation skills and form arguments based on the contemporary literature. And these are essential skills for practice improvement in healthcare settings. So this assessment addresses course learning outcome number 1, where you critically appraise leadership, change management and organisational theories and principles and determine their applicability to your practice. So how do you get started? We need you to choose a scenario relevant to your discipline, so your workplace context, and examine the scenario for potential issues that could be linked to leadership practices or organisational governance issues. So this could include escalation policies, policy and procedural risks, and risk management. For this task, you need to write an essay, so please choose the scenario that's most relevant to your context or specialty stream. Contact me if you've got any questions about the scenario relevant to your practice area. And then you concisely describe the context and situation, including the most important factors that are impacting on the workplace and the delivery of safe, quality care or professional practice. You should prioritise the factors which contribute to these issues in the workplace. So from most important or most critical, and so on. And then you critically evaluate the issues identified that may impact on consumers, patients or other stakeholders in this setting, and then support it with the literature. So this might be about safety and quality care delivery or risk escalation, and how that impacts on consumers and patients and other stakeholders, including staff. And lastly, you prioritise and make recommendations specific to your scenario setting, including strategies that can be implemented to support quality care or professional practice. Now, this sort of task will be really important in your leadership development, and that's why it was designed as part of this course. So there are several different scenarios outlined in the assessment outline, each of them specific for your clinical stream. The scenarios are nursing, midwifery, mental health, infection control and social work. Now, if your stream or clinical area is not represented or closely represented, let me know and we'll work on a solution. So let's talk about referencing. It should be supported by no fewer than 8 references from the scholarly literature, and that includes digitised readings, research articles, relevant government reports and textbooks, and remember they need to be in the last 5 years. We're looking at APA 6th edition style referencing, and your reference list should be on a separate page. So let's have a quick look at the actual criteria. So criteria 1, there are 15 marks available, and we're asking you to concisely describe your workplace context and situation, and including the factors that are impacting on a safe workplace and quality care delivery. So there are 3 criteria here. It's where you concisely describe the most important factors impacting on the workplace. You give consideration to prioritisation of which factors are most important, and you organise your ideas in a logical way. Criteria 2 is worth 40 marks, so it's a lot more heavily weighted. And this is where we ask you to critically evaluate the issues that may impact on consumers, patients and other stakeholders in the setting, and then support it with relevant literature. So here there are 5 different areas that we're looking at. Critical evaluation of issues, expertly supported by the literature. That you consider interdisciplinary roles where relevant, and the impact on consumers, patients and stakeholders. You provide succinct, relevant discussion points and excellent justification of how the issues that you identified impact on consumers, patients and stakeholders in your work environment. You use the literature to demonstrate evidence of wide reading, and you are able to discriminate high quality evidence-based literature relevant to the issues identified. Criteria 3 is worth up to 35 marks. Again, there are 5 things that we're looking for here. And this is all about the recommendations that you make in support of your chosen scenario, including the strategies that we can implement to support improved quality care and professional practice. So firstly, clearly and concisely outlining the recommendations for select issues and how they would impact on stakeholders in the work environment. So the word count is only 1,500 words. So if you find that you've got too many issues in your scenario and you can't address them all, you can clearly outline which ones you are going to make a priority for discussion and give a rationale as to why you have chosen them. You might say that, the most important issue in the workplace is safety and that you'll, mainly focus on that, but that's up to you. Next, you make recommendations that are prioritised according to ease of implementation or impact. Your recommendations clearly articulate the conditions required to fix the issues. The recommendations logically flow from the critical evaluation part of the essay and reflect high quality evidence outlined in the literature. All your recommendations are feasible and acceptable to workplace requirements as well as consumers and stakeholder needs. So please bear in mind that you would have to work within workplace constraints such as resource issues in any workplace. So, talking about putting in an extra 20 staff on immediately might be difficult, and you could talk about why that could be challenging in your workplace. Lastly, 10 marks are available for referencing style and report presentation. So again, APA 6th edition is what you need to use. Start your reference list on a new page. The report presentation needs to conform to the Griffith Health Writing and Referencing Guide. You can find that at the Learning at GU site. 8 references within the last 5 years is what we're looking for. Correct spelling, grammar and punctuation, logical ideas and excellent organisation. And your key points are clearly relevant to your topic. So like I said, refer to the writing and referencing guide at Griffith Health. You will need to submit into the final submission point. This won't become available until you complete the electronic cover sheet. And I won't be marking submissions in the draft folder. The marks don't come across to the Mark Centre, so it is not appropriate. So make sure you find the right submission point. You can use headings in this piece of work if you want to organise your ideas that way. Please write in the third person and use academic language. Refer to the marking guidelines we've just gone through. This will help you work out how heavily we weight different sections. Put your word count on the first page, on the title page. And remember that the word limits for assessment items are strictly adhered to. There is no 10% leeway as there used to be, and the instructions have been that markers should stop reading once they hit the word count, so please pay attention to it. Don't forget the word count doesn't include your reference list, but it does include in-text citations. If you've got any questions, you can email me. I will have also posted some exemplar assessments for assessment 1 in the folder. This will give you an idea of what some previous students' works have looked like. There is a peer discussion board as well, so that you can answer each other's questions, and this is set up to encourage adult learning principles. So often we find that you've got the answers amongst yourselves. And this forum will support that. I will monitor the board intermittently, but I won't be there frequently. So if you've got a specific question, it is going to be best that you email me and I will respond as soon as possible. Anyway, I hope this has helped. I look forward to reading your assignments and wish you all the best.